Following Kate Garraway's husband Derek Draper's death last month, a doctor has given an update about the signs and symptoms of long COVID and how age and health determines its severity. Those still suffering from the multi-system condition can have a wide range of symptoms that can last weeks, months, or even years after infection. Author Michael Rosen, who shared the same ICU as Kate Garraway's husband in 2020, recently told Express.co.uk that he was still experiencing long-lasting damage such as little sight in his left eye, a lack of hearing in his left ear, as well as barely having any feeling left in his toes after catching COVID in 2020. At the time of being hospitalized, he was placed into a coma and told he had a 50-50 chance of waking up. After pulling through his health ordeal, he was then faced with the challenge of having to learn to walk again. While Michael counts himself as one of the lucky ones, Derek sadly didn't have the same outcome and died last month after suffering from a cardiac arrest following a 3-year health battle. Talk TV presenter Piers Morgan was also left experiencing health issues months after contracting COVID and in 2022, called for more research to be done on the unpleasant side effects such as loss of senses and bad fatigue. Now, Dr. Natalia Bogacheva, GP at the London General Practice, has said the highest percentage of long COVID currently stands in between the ages 35 to 50 years. She shared, long COVID is a multi-system condition comprising of a wide range of symptoms that follow an acute infection with SARS-CoV-2 virus. Although most people fully recover from the infection, around 10% of infected individuals will go on to have long COVID. It may affect any age group, including children, however the highest percentage of diagnosis is in between the ages 35 to 50 years. Most of the affected people would have had mild illness, although in hospitalized patients with a severe COVID, the chances of having long COVID is more than 50%. Long COVID can also occur in people who have been vaccinated and catch COVID afterwards.